Well, first of all, I want to thank you all for coming and giving us a bit of your time. We are medical students from the Erasmus Medical Center in Rotterdam, the Netherlands, and as already said, we're third-year medical students now, and we're collaborating on a project with the Technical University in Delft, and together we're trying to form the SCHISTOSCOPE. So first, I would like to tell you a bit more about our collaboration. The Erasmus Medical Center and the Technical University in Delft are working together on a project called Diagnostics for All. And currently, at the Technical University, they're already that far that they have a working prototype with proof of concept that will say that they tested with real urine samples, but not in the lab settings they would like to use it in, so like rural, low-resource areas. And before they start testing on the field, they still want to have a few iterations and some few changes to even improve the design further. And in order to do that, we need your opinion about what the SCHISTOSCOPE and to be able to test it in the field later on.
This is the sample preparation. What you do is you have 10 milliliters of urine and the sample preparation, and you filtrate the urine so all the eggs will be on 3.5 millimeters of a filter membrane. After that, you can put the filter membrane, you can slide it in at the side, and then there will be the smartphone and there will be a lens under it, and you can take a picture of the whole 3.5 millimeters. So you will have the in one picture you will have the whole view of the filter. It consists of an algorithm that will detect and estimate the amount of eggs. So it reduces human error and has high sensitivity. Well, some additional values, it's now used only for urine, so for hematobium, but it could be used in there if the sample preparation is altered. So, for example, feces could also be filtered, and they're working on it. Then it's also you're also able to use it for the other types of schistosomiasis, and it could also be used for other types of diseases. It's also to enhance the epidemiological knowledge where schistosomiasis is still prevalent.
Now imagine a setting like they mentioned in Nigeria, but it could also be rural Kenya across the border of Lake Victoria. There's no electricity over there, there's a limited amount of trained medical personnel, and there's absolutely a limited possibility of maintenance and production of microscopes. When using the SCHISTOSCOPE, you tackle all of these problems individually. Electricity wasn't required because we have a power bank installed. Limited trained medical personnel is tackled because the algorithm detects and estimates the amount of eggs. And microscopes are not necessary anymore because of the use of the camera inside a mobile cell phone. The cost of the device itself is 481 euros, so that translates to 55,000 Kenyan shilling. And the cost of the cost per diagnose is heavily dependent on the amount of diagnostics you do each day. So the Technical University in Delft made an estimate that if you were to do 50 diagnostics each day, so 13,000 per year, the cost will be 72 Kenyan shillings. And this is with the use of the highly expensive filter that is now being used to prepare the urine sample so that the eggs are concentrated on the filter. As I said, they're now mainly focusing on work with a cheaper filter, and that will reduce the cost to only 3 Kenyan shillings. Furthermore, we would like you to answer a couple of questions because we really need your opinion to improve this prototype. Thank you very much for your attention.
It's a good one. When do you think they want to roll it out here for field testing?
As we already said, it's more. There's still your opinion is necessary to optimize this design still, but they already are starting testing in the field in Nigeria, where I think they're already started. So they would love to start here as well. If we tell them that you're very enthusiastic about this project, I think they
will get in contact with you within minutes.
Yeah,
I'm pretty sure.